Doctors say RSV arrived earlier than normal this year, and we're all wondering why. Dr. Perry Wilson is here to discuss this troubling illness. Good morning, doctor. Thanks so much for being with us. So we know RSV is common, but what's made it so severe as it seems this year?
Good morning, Shyann. Thanks. That's the big question right now. It's clear that the RSV surge is coming much earlier than it should. Typically, RSV season is November, December through about April. And the big question is, are we seeing just an earlier season, or are we seeing things that are harbinger of things to come? Are we going to see much more cases? And the real concern is that because of COVID isolation practices, we had very low rates of RSV, particularly in the first year of the pandemic. And there may therefore be a lot of kids who have no immunity. Their immunity has substantially waned and are thus a lot more susceptible to severe disease from RSV. That's the concern.
So for parents watching right now, even grandparents, what should we be looking out for in our kids? Signs, symptoms?
So in most kids who are older, RSV looks a lot like a cold and a cough. Runny nose, cough, and most kids do just fine, do not require hospitalization. But it can be severe, particularly in younger kids, kids less than 12 months, kids with other medical conditions that, particularly respiratory conditions like severe asthma, can have a bad run of RSV. So just do what you normally do. If you're concerned about your kid, if they're acting lethargic, particularly if you have an infant that's coughing a lot, or looks like they might be breathing faster than normal, or having what are called retractions, which is where the skin in between the ribs sort of looks like it's pulling back when they breathe. Any change, call your doctor, and they can walk you through whether it will be necessary to come to the emergency room, have an urgent visit, or just manage things at home.
In most of these cases, though, if you catch them early, are they treatable?
Well, RSV does not have a specific treatment beyond supportive care, but some kids need hospital level care, particularly for supplemental oxygen and medications to help ease wheezing that can occur with RSV. So you don't want to get to the hospital too late, particularly if a kid is very ill and needs oxygen. But to prepare some parents, even if your child has RSV, for a lot of kids who are doing relatively well, it's, a lot of TLC at home.
All right, Dr. Perry Wilson, thank you so much for your time and expertise. Appreciate it.